Minerva Santos, and welcome to Your Health Today, the show that answers questions about your health today. My guest today is Dr. Larry Baskind, who's a pediatrician in the Croton area, the Hudson Valley area, for many, many years, and who also does homeopathy. And he's here mostly to talk about the homeopathy. My first question, Larry, is how did you get involved with homeopathy to begin with? Then the second question is, what is homeopathy?
Okay, so I'll answer your second question first, which is, what is homeopathy? And it is not what a lot of people use it to indicate a broad range of alternative medicines. Homeopathy specifically is a branch of medicine that was developed the late 1700s, early 1800s, and utilizes small amounts of a substance, almost infinitesimally diluted substances, under the principle that like cures like. So in other words, if you have a person who has, the founder of homeopathy, Samuel Hahnemann, experimented with quinine, which was known as cinchona, the Latin name for the substance. And he found out, interestingly, that quinine in toxic amounts caused a clinical condition very similar to the very disease that it was used to treat, malaria. In other words, quinine in high doses gave someone rashes, fever, sweats, achy joints, and so forth. And so he reasoned that if a substance could cause these symptoms, it could, in lesser dilutions, cure those symptoms. And in fact, that's what he spent the rest of his career, about 30 or 40 years, experimenting with that. So homeopathy is the principle that like cures like. Specifically, it comes in many forms, but the most common form would be little pellets that dissolve under the tongue. As you mentioned, I'm a pediatrician, and as you can imagine, little white pellets that taste like candy because they're made from sugar are very popular and very well tolerated by children, my patients. So homeopathy is a branch of medicine that is defined and actually unique, where like cures like. I got started doing this. I was the the pediatric director of the Peekskill Area Health Center, known as now Hudson River Healthcare, in the 80s, and I had just finished my residency, and you know, you come out of residency, you think you know close to everything, you know, but close to everything, not quite everything. And I started getting frustrated when kids, specifically with ear infections, should be the simplest thing in the world to treat, really, ear infections, they didn't seem to respond sometimes to antibiotics. And what made matters worse for me was sometimes after they had surgery to put tubes in their ears, they still didn't stop having ear infections. And this worried me very much because, to my knowledge, those were the only treatments available for children with chronic ear infections. So around 1990, I started researching other medicines like that, and I happened to come upon some books by Andrew Weil, most people know, and he had discussions of different types of alternative medicines that were very useful, specifically for ear infections in children. And I ended up taking courses in Western herbal medicine, Chinese herbal medicine, a fascinating discipline called craniosacral osteopathy, which is a fascinating and powerful intervention. It's a little, it's not very popular or understood, but I've been practicing medicine, as you mentioned, for a long time. It is one of the most effective medicines for a variety of conditions. And then I ended up taking courses in homeopathy, becoming not only intrigued with it, but also finding that it was very useful in pediatric medicine.
And for instance, give me, besides, how do you use it besides ears? I know that you have that fascinating story about the young boy who had the sweating.
Yeah.
And that I actually, as you know, I've taken the homeopathy course.
Yes.
And I used it on a female patient of mine who came in and was complaining about this incessive sweating and was using special deodorants.
Right, right. Yeah, that's so that sort of falls under the main title of I use homeopathy for conditions that I don't have good conventional medicines for. So that's a perfect example. The excessive sweating, which is of course called hyperhidrosis, is a problem that bothers a lot of people. And I've used it. I mean, it's not homeopathy, like any other medicine, is not 100%. When a prescription is well thought out and tailored to the individual presentation, the individual needs of the patient, it can be highly effective. As in the case of the young man with the excessive sweating, I used 2 medicines for him, and I've used it since then in several patients. Most report an improvement, not a complete cure. So I use homeopathy in general for difficult to treat cases, or in cases where conventional medicines have failed. Sweating is one of them. Eczema is another.
I've had really good success with eczema.
Right.
And I tell patients, I don't know if this is going to work, but do you want to try it?
Right.
And they're game, because they don't, at this point they're basically taking steroid baths because nothing else works. And I'm amazed. Every time it happens, I'm like, wow, that's very cool. That works. Right.
Exactly. And it's not really a wow of surprise. It's a wow of fulfillment. I mean, it's just so this is what we hope for when we practice medicine, which is to find ways to get our patients better. I also get frustrated when I prescribe the proper treatment in conventional medicine for my patients and it doesn't work, or they have a difficult time with that and they don't improve. And first of all, the patients are dissatisfied to a degree, and I'm a little frustrated too. So I found homeopathy not an answer for everything, okay? But homeopathy is another tool in our toolbox. As you know, there are other tools that we use. We used herbal medicine. We use nutritional advice. I mean, we use lifestyle advice. A lot of times with teenagers, I have to tell you that with teenagers, giving them a good word of heartfelt emotional advice sometimes is enough to change, for example, bad eating habits, bad sleeping habits, and so forth. I've had a profound impact on patients just by giving them really, pointed heart-to-heart advice. But in homeopathy, first of all, the medicines are very easy to take. So as a result, you tend to get better compliance, and actually, of course with teenagers, that's a big thing. I remember I had this one kid who came in and he said, listen, that medicine you gave me for acne isn't working. Well, did you take it? He goes, no, I'm not using it. Well, okay, so I guess it's not working. But homeopathy is a little easier to comply with because the medicines taste so good. I've also found that it's one of my goals, and one of the things I try to explain when I lecture too. I've given grand rounds in several medical schools here in New York and in New Jersey, and I started off one time with a very interesting premise. I said to the group, because I've run into resistance before with conventional doctors just think that this is
voodoo.
Voodoo medicine and so forth. So what I said was, I'd like to ask everybody in this group, what is the goal of asthma treatment? In other words, what's the goal of treating people with asthma? Obviously, it's not to prescribe either steroids or beta agonists or any specific medicine. It's really